Yeah, anyway, very good afternoon. Start Mana. Okay. So like probably after a long time we are having a class for PG scholars. Okay. So today I'll start with a very important group. We look at the generalities of a group character, and this group is a group which is very often used in our homeopathic materia medica. Okay. So we'll look at the details. We look at the details of this particular group. See now this group is what is audible? Okay. So this group is what we commonly, we use in our materia medica, and I'll directly come to the group characters, and we will try to explore Ophidias in this class. Okay. Now, snake remedies are grouped under Ophidia. Okay. So we look at the group characters of Ophidia. This is what I was trying to highlight. And as a PG scholar, you would have learnt a lot about Ophidias. So we'll try to also have a small interaction. What exactly you already know, and what I am going to contribute in today's class. Okay. So we will have a set of objectives so that the class will be focused. Okay. So at the end of the session, the PG scholar will be able to list the sphere of action and pathogenesis of Ophidia. Okay. So this is the first objective that I have planned for today's class, and we'll also look at the ailments of Ophidias. Okay, what are all the common ailments of Ophidias, and I'll also try to tell you the diathesis and the side affinity of Ophidia. Okay, and as we go further, must be in the next class, we'll try to understand the mind or the mentals of Ophidia, and slowly we'll also look at the physical characters or physical generals of the entire Ophidias, and wherever there is a scope, I'll try to explain the cases that have where I have used Ophidias in my clinic. We'll be looking into that particular area, and very important, in many of my group character lectures I have been focusing on this area. Okay, how you differentiate different Ophidias. Now this is a very important area, and we will look at that area, as and how the class progresses. Okay. So first thing, to make it more precise, in today's class specifically, I'll be trying to introduce you to Ophidias. Okay. We'll also try to classify snakes. Now what is the idea of classifying snakes? It has some meaning. We'll try to explore a little later, and we'll also look into the pathogenesis. Hopefully in today's class I'll be mainly focusing on pathogenesis. Okay, and we'll look at the miasm, the predominant miasm Ophidia belongs to. Okay, and of course again the diathesis, the side affinity, and the thermals. Okay, now we'll try to classify snakes. And after 5 minutes, you will understand the importance of this particular exercise. Why we are trying to classify snakes. Any quick inputs? Why we need to classify snakes? That's the first question. And the second question is, what is the classification? How are snakes classified? Now, before you start answering this question, if you look into Google, if you look into snakes, if you type snakes on the Google, you have pages of information given. Okay. Now there is also a heading, snakes and mythology. There is a heading, snakes and mythology. We will not look into the history part, but what I also want to try to tell you is, in mythology, you take the Chinese tradition, the Indian tradition, snakes, they have their own value. Okay. In India, for us, snake is God. Many of us do pray snake. do prey snake. And in the other, histories, the traditions, there are different culture and different mythology associated with snakes. We will not go in details, but I just want to try to tell you that snake is a very ancient creature. If you look into the evolution, okay, it's a very old creature, fine, and it is still there. So it has a lot of meaning. We'll try to explore a little later. We'll come back to the question that I asked you. How do you classify snakes? First question. And what is the importance or relevance of classifying snakes? Dr. Venkatri, you started with some answer. Yeah, what was it? Okay. Okay, you basically classify snakes into poisonous and non-poisonous. See, now this information you will have to track back to your FMT. Okay, there was a chapter, snake poisoning. So if you look there, the snakes are basically classified, as Dr. Krishnadas rightly said, into poisonous and non-poisonous. Okay. Now our focus is not on this area. We are not looking at that because the majority of Ophidias that we have in our materia medica, they are all poisonous snakes. And the part that we use in the Ophidia is the venom. So when you look at the poisonous snakes, they are again subclassified into Elapidae, and we also have Viperidae. Okay. What is the third classification? We also have Hydrophidae. Okay. Elapidae, Viperidae and Hydrophidae. See, Hydrophidae, as the name suggests, they are mainly sea snakes. They are mainly sea snakes. Okay, we have one remedy which is prepared from the sea snake. I will go into the details a little later. For time being, this is how the classification of snakes is done. Okay. So when you look at Elapidae, we have two very important remedies, coming from our materia medica. One is king cobra or naja, and the second very important remedy is bangaras. These two remedies are prepared from Elapidae. Okay. Now when you look at Viperidae, we have many remedies coming up. Crotalus horridus, Crotalus cascavilla, Vipera, they all belong to Viperidae. And the third remedy or the third group of classification we had is Hydrophidae. See, under Hydrophidae we have a snake, I was just trying to share, a sea snake, and that is Hydrophis cynosintus. This is a remedy we have in our materia medica. Not oftenly used, but it is there. Okay. Now, what happens when a snake bites? Now, this brief history is very important in understanding Ophidias better. Okay. So, what do you think will happen when a snake bites? You have already studied this in your forensic. Okay. Now, what happens? You see a man being bitten by a snake, and assuming that this snake belonged to Elapidae. Okay. Now examples for Elapidae, what we saw? Cobra, you have it here, king cobra, and we were also talking about bangaras. Okay. Now first thing is, when there is a snake bite, and assume that the snake bitten is from Elapidae, what are the series of things that happens? Death directly? Okay, blood clot, before blood clot. Okay, there is something called as local affection and there is something called as systemic affection. Okay. So when you are talking about local affection, you see, mark of injury, local rise of temperature, and then the venom is getting into the bloodstream. So when the venom gets into the bloodstream, okay, what is it doing? So now what it is doing, it depends upon the toxins. It depends upon the toxins. So Elapidae, basically when you see here the events mentioned, there will be sinking feeling, there will be drowsiness and blurred vision, diplopia, dysphagia, and you can also see paralysis of tongue, pharynx, respiratory muscles and the limbs, and in the end it will give rise to coma and death. Okay, so what do you understand? The venom of Elapidae, what is it that you understood from this sequence is, what is it that you understood? That Elapidae is predominantly neurotoxin. Elapidae is predominantly neurotoxin. Okay, so you see more of nerves getting affected. Though Elapidae venom or the snake venom also has hemotoxin, here predominantly what you see is it is more of neurotoxin. This is very important. See, you will slowly understand why I am trying to give you this piece of information. Okay. So moving ahead, the cause for death here will be asphyxia. Try to understand. The cause for death here is asphyxia. Okay. We'll go ahead. Now we'll see what happens if a Viperidae snake bites. Okay. So Viperidae snake, when it bites, you see predominantly bleeding of gums, you will see epistaxis, and you will see purpural hemorrhages. You will also slowly see in the next stage there is hematuria, there is melena, and a person will go into shock, hypovolemic shock. And the cause for death here is collapse in BP. What was the cause for death in the other snake that we saw, Elapidae? Asphyxia. Here the cause of death will be collapse in BP. So what you understand, that Elapidae, the toxins are predominantly hemotoxin. Okay. So what remedies did I tell you under Elapidae? We had more of Crotalus. Hala. Fine, we had more of Crotalus. Done. And in the other group, we had more of king cobra, Naja. So what is it that immediately strikes to your mind? What is that understanding you got here from this information? That Naja, clinically tomorrow in our practice, we don't indicate Naja in hemorrhagic diathesis. Okay. I told you a beautiful book to understand Ophidia is E.A. Farrington's Clinical Materia Medica, first chapter, and he has written his first chapter on the animals, and he explains Ophidia in detail. And there Dr. E.A. Farrington clearly says hemorrhages in Naja is least. You have very minimal or no hemorrhagic tendency in Naja. If you again cross check the repertory under generalities, under hemorrhages, you don't have Naja being mentioned. Okay. Now you know from where did this piece of information come. Now that is what I am trying to connect. So tomorrow please don't think of Naja in a patient with hemorrhagic diathesis. Think of some other Ophidia. Okay? Think of some other Ophidia. Don't think of Naja. That is the clarity I want to give you. Now why is because of this? Because Naja is mainly neurotoxin and Naja has very minimum of hemotoxin. And Viperidae has more of hemotoxin and very less of neurotoxin. I hope you are clear. Any questions at this stage? Simple, we are trying to build up a foundation. The information given now will help you understand Ophidia better. Okay? So we'll go ahead and we'll try to understand what are the common Ophidias used in our Materia Medica. See, if you look into the books, if you look into the net, there are some 15 Ophidias we commonly use in our Materia Medica. Okay? Can I have the list? Starting with lachesis, naja, Crotalus horridus, Crotalus cascavala, beautiful, good. Elaps, 5. Bothrop, 6, good. Vipera, 7. Synchris, 8, good. We are Bangaras, 9, good. We also spoke of a sea snake. Okay, good, 10. We are left with 5. Good, anyway, I'm happy. You could recall so many Ophidias. Okay. Now, under Vipera, you have 3 varieties. That's why they missed 2 more. So it will become 12. And Toxicophis, I have never used this. And even this Clotho arictans and Ophiotoxinum. These rare snakes, at least I have not used it in my practice. Okay. And say till 7, and of course I have used Synchris. So 8 Ophidias I have commonly used in my practice, but there are 7 more Ophidias which I have not explored much. So probably if I have a better understanding of Ophidias, we can start applying the other Ophidias also effectively in our clinical practice. Okay. We'll have a quick game. Game means you need to just guess. It's a 3 to 4 class. Very tough for a teacher. So I have just got some images. You need to identify which snake. Okay. Again, images taken out from Google. Okay. So this, which is this? Are the images clear? Dark. Okay. So you just see if the images are clear, or will. Okay, must be this will be better now. Okay. So we are trying to make it a little more darker, the room, so that you get a better image. Okay, good. Thank you. So which is this snake? Russell? Viper. So this is lachesis. Lachesis trigonocephalus. Okay, great remedy. Very often we use in our clinic. Okay, and credit goes to Dr. Herring. Must be when I tell you about lachesis, I'll tell you more about lachesis. This is just a small game. So we are just trying to identify the snake looking at the images. So this is Crotalus horridus. See, if I had shown you the tail, probably you would have identified. But I am also acting smart. I am playing with your emotions, hiding the important clue. Okay, fine. This is Crotalus horridus. Okay. Now this snake, a very dangerous snake from South America. Now this is Crotalus cascavala. Beautiful snake. Snakes can't be beautiful, but but anyway, no. I mean, as a remedy, as a drug picture, we have wonderful results in our clinic with Crotalus cascavala. So must be when we get time, we will try to explore Crotalus cascavala, and this, at least this is some simple remedy that we can think of. This is elapse. Oh, sorry, this is hydrophis. Hydrophis. Okay. Sea snake, a water snake. And then we have, this is something which we can't miss. This is Naja. So Naja tripodians, and we see this is, see this and this look little similar, but this is more colorful, and it looks like coral. We'll go into the details a little later. And this is Elaps corollinus. Okay, Elaps. Very colorful snake. The other snakes were beautiful, and this is very colorful. Okay. So Elaps, and we also have few more. Like for example, Bothrops. Bothrops. In your medicine, therapeutics, you would have come across this particular remedy, Bothrops. We'll explore more, and very, again, a dangerous snake, huge one, dangerous snake. If you see here is Synchris. Synchris. Okay. Now moving ahead, we have another snake, and This is Vipera. Vipera, we have three species that we use here. Vipera torva is this, and this is Bungarus. Now what is Bungarus? Where did we classify Bungarus under? It was Elapidae. Okay. Two snakes I told you. One was Naja and the other snake given there was Bungarus. Again a very important snake. And Adder. I have never used this, so we'll try to explore. So these are the common snakes we use in our homeopathic materia medica. Okay. We'll go ahead. Probably this piece of information I am giving you now is also what you have already studied. But we are trying to go a little more systematic in understanding the remedy. Okay. Now what does a snake venom contain? What exactly is snake venom contain? Huh? Okay, it is a salivary secretion. Fine. Okay. Fine. But what are the toxins? The main classification. The venom, what exactly it contains? It contains, we already discussed two toxins. Neurotoxin and hemotoxin. What is? Very good, myotoxin. Good. See the name, hemo, neuro, myo, it makes a lot of sense. Okay. And what you need to understand is, the venom, snake venom mainly consists of neuro, hemo, cardio, cyto and myotoxins. There could be a bigger list in the internet or from your forensic books. I have taken what is important for today's class. Okay. So if you look at this, now why is this important? Any quick guess? Why am I trying to go deep into the bite? What happens when there is a snake bite? And now we are trying to understand whatever happened there. Fine. Why all those things happen? Yes, very good. Now this will give us, or this knowledge will help us understanding pathogenesis better. Okay. And every remedy, if you understand the pathogenesis, then it will be very easy. Okay. We can clinically and even explanation becomes very easy. Okay. So we'll go ahead and we'll try to understand what exactly the neurotoxin does. See, you need not read the slide, but from your understanding as a PG scholar, what will the neurotoxin do? It will act on nerves. It will act on the cerebrospinal system. Okay, and it will cause a lot of problems. So a neurotoxin, from the information I have taken from Wikipedia or the Google, what you see here is neurotoxin mainly causes ptosis, muscular weakness of legs, paralysis of the muscles of face, throat, respiration. Now this is the main reason. It acts primarily on the motor nerves. Bulbar paralysis. Okay, we are talking of a snake. What was the snake? Which is the snake which you studied in your medicine, which can cause bulbar paralysis? Naja. One more. Bothrops. Okay, bothrops. And there is pulmonary inflammation and then there is edema. This is all what a neurotoxin is capable of causing. First point. Second, if you look at the myotoxin, as the name suggests, myotoxin is a toxin which mainly affects the muscles. Okay, the muscular pains, the myoglobinuria, all those things are the respiratory failure that happens. It is all because of this myotoxin. Okay, and the third venom, is hemolytic hemotoxin. Now, hemotoxin, it breaks the RBCs. Okay, it separates the plasma and hemoglobin, which brings down the oxygen carrying capacity and it results in cyanosis. Now this is what happens when there is a snake bite. Okay. Declining coagulability of blood. In which group of snakes you saw this? Viperidae. I told you, I started with bleeding from gums. So why will that bleeding from gums happen? Intracranial hemorrhage, hypovolemic shock, renal damage and pulmonary embolism. All these things are possible because of hemotoxin. Okay. And last two we have is cardiotoxin, which is the venom in which cardiotoxins are more active. Again you have nausea. Okay. So cardiac arrest, low blood pressure, severe shock, myonecrosis, all this are because of cardiotoxins. Okay. Now the last thing here is cytotoxins. See, these cytotoxins are responsible for tissue necrosis. You know, many of the Ophidias are beautiful remedies for gangrene. So now this is possible because of cytotoxins. Okay. Neurotoxin, myotoxin, hemotoxin, cardiotoxin, cytotoxin. 5 I have picked up for today's class. Okay. Now the next beautiful question. See, we are going very systematic and I assume it is all linked. Okay. I hope you are getting it. Now the next question that comes up is, what could be the probable sphere of action of Ophidias? Okay. When I say sphere of action, as a PG scholar, we are going a step ahead and we are also looking at the pathogenesis of Ophidias. Okay. Any confusion, anything that needs to be clarified till now? All of you? All fine? Okay. So now we will focus on a very important area. And what is that area? Or what is that question I asked you? This is where we have stopped. What could be the probable sphere of action of Ophidia? Now try to understand, try to look back. You know all this. This is what a venom is capable of doing. So now, similia similibus currenter. We'll go back to the sphere of action of Ophidia. Illi. When you talk of neurotoxin, mainly what comes up? Cerebrospinal system. Very good. First. Second. Circulatory system. Good. Or blood. Good. Possible. Third. Muscles. Yes. Muscles. Heart. Yeah. Cardiotoxin. Heart. Where else do you see Ophidias acting? That Amrish, you need to load up. Where else? See, first, anyway, we'll just start off. Must be you can slowly start contributing. The first area in majority of the snakes we see is it affects the cerebrospinal system. Correct? Now, I was reading Burt's Physiological Materia Medica by Dr. William Burt. Beautiful book to understand pathogenesis. Now, Dr. Burt says it mainly affects the medulla oblongata. He also continues writing, it affects the sensory nerves, optic ganglion and the olfactory ganglion. He says a person bitten with snake, his eyes will be dilated and he will not be able to smell. He says bring the worst smelling thing in front of his nose, he is not able to smell it. So olfactory ganglion is getting affected. Medulla oblongata is getting affected. And in the further lines he adds, Ophidias have a specific affinity for pneumogastric nerve. And you all know that common symptom of Ophidia. What is that beautiful symptom of Ophidia? Which, I am happy. When I said this, all of your hands voluntarily move towards the neck. Good, I am happy. So, you all know Ophidias will cause constriction. Sorry, Ophidias cannot bear constriction. Done? And when you look at the scientific reason, why is this happening? And this is where you get the answer. He says pneumogastric nerve, glossopharyngeal branch, that is getting affected and it causes constant irritation and spasm of the pharynx and the larynx. Even Dr. E. Farrington nicely writes, I'll explain it a little later. Okay, he says this area in Ophidia is very sensitive. Okay, and if you are looking at doctrine of signature, you would have seen a snake catcher. Okay, Discovery, some movies, some videos, WhatsApp videos, you would have seen how a snake catcher catches the snake. Will he hold the tail? No, he will hold the neck, because this is the most sensitive area even in a snake. When you hold it, it can't move or it can't do anything. Fine. So even doctrine of signature, you see that neck is a very sensitive area in the snakes. So a person requiring Ophidia, it is also observed in proving, and it is confirmed from the poisoning that the glossopharyngeal branch of the pneumogastric nerve is very sensitive. Okay. Now in toto, what will Ophidia cause acting on the nervous system? It mainly causes muscle twitching, spasms, convulsions and paralysis. This is the action of Ophidias on nerves or cerebrospinal system. Okay, so going ahead, many of you are talking about the action of Ophidia on heart. Very important. Okay. Now, what will Ophidia do acting on the heart? I'll have two small questions for you. What will Ophidia do acting on heart is the first question, and which are all the Ophidias which will predominantly affect the heart? We'll also include the last statement. Okay. So what is the first question? What is the action? What is the action? Okay, valvular affections. Before that, one simple thing you have here is, it will mainly weaken the myotoxin, the muscles, or the muscles which, the nerves which are supplying the muscles, they go into weakness. Okay? So weakening of the muscular activity of the heart. So what happens when there is weakening of the muscular activity of the heart? The heart pumping gets affected. Blood flow to the periphery gets affected. So how is the Ophidia's hand, legs to touch? They are cold. Okay. And Dr. E. F. Farrington beautifully writes in his Materia Medica, belladonna also has cold extremities. How is belladonna different from lacasis? What will happen in belladonna? The is congestion. Blood is rushing to the head and it is not getting supplied to the extremities. The issue in belladonna is not heart. The problem in belladonna is there is congestion. In Ophidias, the problem is the heart is not functioning properly. Okay, so the extremities are cold. Done? So it affects the heart, it causes weakness, the heart action becomes weak and there is cold feet. Yeah, no. Which are all the remedies? Which are all the Ophidias? We will not talk of remedies. Which are all the Ophidias which have an affinity for heart? To start with, number one remedy will be Shweta, Naja. Shweta is not the number one remedy. Right? She was talking of Naja. Naja is the number one remedy. Similarly, number one remedy equivalent to Naja which can act on the heart, Ophidia, is lacasis. Okay, these two top the list. Okay, it does not mean the other Ophidias will not act. They do act, but not to the extent like Naja and lacasis. Now again, for a PG scholar, how do you differentiate the action of Naja and the action of lacasis on heart? Very good. So the idea of making you read E. F. Harrington in the last class, so Dr. E. F. Harrington nicely says, NASA has an affinity for the valves. VHDs are more of NASA. RHDs are more of lachesis. Rheumatic heart disease, if it is an Ophidia that is getting indicated, you can think of lachesis. And you see is an Ophidia but more of valvular affections, then you can think of nausea. Clear? Very, very important and practical tips given from your stalwarts, and they are giving it out of their experience. So please make use of those simple the clues that they are giving it for us. Okay? So nausea and lachesis are the topmost remedies, but there are also other Ophidias which can affect the heart. Synchris, Crotalus horridus, Crotalus cascavella are few more Ophidias which affects the heart. Okay? Now we'll get back to blood. Dr. Padmashri was talking of Ophidias acting on blood. Okay? But again, two small questions. What will Ophidias do acting on blood? The answer I have already given. You should have been alert when the previous slide was explained. Now when you talk of blood, what is it that you are going to recall? We are going to recall the action of hemotoxin, which was already explained. Okay. So acting on the blood, what will the hemotoxin do? It will cause hemorrhages. It will cause issues with clotting. Correct? No? So what you need to understand here is Ophidias acting on the blood, it will cause degeneration. What was the word used? It will cause breakage. Correct? No? It will cause breakage of the RBCs, hemolysis, destruction. Okay? Not only destruction, it will cause decomposition. It will cause hemorrhages. And one word that should come to your mind is septicemia. Very important. Septicemia. If you look into the rubric septicemia, you have, like I said, you have Crotalus horridus. Now, which are all the remedies which will affect the blood? In the hierarchy, the Ophidias affecting the blood. In the hierarchy, you have Crotalus horridus, lachesis, bothrops, 3 mark remedies. Then you have Crotalus cascavella. Then you have elapse. Then you have vipera. And you don't have nausea. Very good. You don't have nausea. Why? Because nausea causes least hemorrhages. The statement given by E. F. Harrington, and we have also confirmed in the repertories, we have also confirmed from the toxin. Okay, it causes very little of hemorrhages. So, any clarity or any clarification here? Hope you are getting a systematic understanding of Ophidias. Okay, we'll go ahead and we'll see where else. This is something very important. Many Ophidias are glandular. Okay, now which glands Ophidias affect is mainly, which is the gland Ophidias affect? It mainly affects the liver. It affects the salivary glands. It affects the tonsils. It will affect the ovaries. It will affect the testes. Okay. So glands, lymph glands. When it is lymph glands, one remedy you should remember is vipera. Lymphomas. Okay. Vipera, don't forget vipera. We'll discuss, we'll go ahead. Skin. You also see Ophidias acting on the skin. What is the result? What do you see Ophidias doing? It will cause abscess, it will cause eruptions, erysipelas. Okay? Fine, it can cause gangrene, it can cause necrosis. Which toxin is responsible for necrosis? Cytotoxin, not myo, cytotoxin. Okay? So, a venom which has more of cytotoxin, that will give rise to necrosis, that will give rise to gangrene. Okay, so erysipelas, abscess, carbuncles is all what you see on skin. Now you have another area, very important area. You know, many times there are people coming to our clinics with cellulitis. When the cellular tissue goes into inflammation, we call it as cellulitis. You see a huge swelling, secondary to typhoid, secondary to diphtheria, secondary to some injury. Okay, you see cellulitis. Okay, swelling, redness and all. There you can think of ophidias. And if I am right, I remember reading it in Dr. Burt or Dr. E. Farrington. There they say cellulitis which is dark, cellulitis which is black, you know, you can think of ophidias. They say that could be an entry point for ophidias. Okay, so moving ahead, last two slides, we also have ophidias acting on the female genitalia. Okay, keeping the action of neurotoxin, hemotoxin, myotoxin, we can think of a lot of things here. And keeping the glands, the ovaries, you can think of a lot of things. Okay, inflammation or hemorrhages, menorrhagia, dysmenorrhea, nymphomania. If I am right, according to the Chinese tradition, snakes are good aphrodisiac. Okay, fine. They are eaten because they feel it increases the sexual appetite in men. So according to them, they are great aphrodisiac. Okay, so excess sexual desire in men, excess sexual desire in women, nymphomania is what you see in ophidias. So similarly, it also has an affinity acting on the male genitalia. You see arthritis, or you see sexual disturbances, excess sexual desire. All these things are possible under male genitalia. Kidneys. I don't know if I have an image of kidneys, but yes, anyway, you also see ophidias acting on kidneys. It could be as simple as inflammation, or it could be hematuria, it could be cancer. We have ophidias indicated. Okay. So majority of the ophidias are deep acting remedies, and you see that they are polycrust and they have wide range of action. And if you are looking at the diathesis, the diathesis is mainly hemorrhagic diathesis, mainly hemorrhagic. Okay. And if you are looking at the miasm, what is the predominant miasm? All three, psora, psycho, syphilis. But what is the word I have used? Predominant miasm, mainly psychosyphilitic. You will see under physical generals, you will see what symptoms ophidias can produce. So predominantly psychosyphilitic. Okay. We'll stop here. In the next class, I will be discussing the physical generals. Hopefully 40 minutes, 50 minutes we'll try to dedicate for physical generals, and a class after that I'll try to give you a mental picture of ophidias. And then we can talk of individual ophidias. I'll give you a few characteristic indications of individual ophidias. We'll not go in depth. I'll just give you the characteristic thing. Practical indications of ophidias. Okay. Now before we close, any inputs, anything you would like to add, or any questions, any clarifications? Yes, Dr. Krishna. Okay, but mainly valvular. See, Naja, I was just trying to tell you, when you look at the venom, Naja also has hemotoxin, probably in a lesser amount. Neurotoxin will be more in Naja. Crotalus also has neurotoxin, but neurotoxin amount might be less. It will have more of hemotoxin. Similarly, when you look at the heart, okay, according to the stalwarts, Naja will have more affinity for valves. It might have, but when you are looking at the affinity, fine, valves will take a upper hand in Naja, and rheumatic heart disease, RHDs will take an upper hand in lachesis. Now this is the small difference. You might have even valvular affections. You have lachesis mentioned in your repertory. I don't deny. I am looking at the hierarchy from the source books. Okay. Okay. Good. Anything else? Okay. We'll stop there. Chalo. Thank you.